Hi everyone and welcome back. If you're new, then a massive welcome to you. My name is Dr. Baptiste and I currently work as a portfolio GP. In this video, we'll be hearing from Dr. Nigel Giam, who is an AKT and RCA trainer, among other things. And in this video, he'll be talking about case selection for the RCA exam.
Hi everyone, it's Nigel Giam, Lead Training Program Director for the St Mary's Scheme and AKT and RCA trainer for HEE London. Thank you very much to Patrice for inviting me on to talk about RCA case selection. So let's crack on. Global Competency 4 has been highlighted by the examiners really as poor choice of consultation. I'm an ex-RCGP examiner, so worked for the RCG between 2003 to 2007. I've been a lead training program director now for about 15 years. So I've seen a lot of RCAs over the last couple of years and helped a lot of STs with regards to case selection and also case calibration. So poor choice of consultation is described really as a case which has lacked complexity. This can occur when a straightforward clinical problem has been chosen that requires few clinical skills, or when a consultation is chosen that does not address a new clinical problem. If you read in between the lines, what they suggested is that you should really be avoiding follow-ups, sort of medication review requests, and do ask yourself this question, that if essentially the case could be done by, for example, a clinical community pharmacist or a practice nurse, then actually it's not going to be a case that's necessarily worthy of challenge. So for those of you who are preparing for the autumn sitting, just as a reminder, it's 13 recorded consultations, it's 12 minutes once consent has been taken, and you're going to be assessed in the domains of data gathering, clinical management, interpersonal skills, each domain carrying a top mark of a clear pass, which equates to a 3, a clear fail, which is a 0. So there are 9 marks in total per case, and you've got 2 examiners marking you over the 13 cases for submission. Just make sure you get your mandatories in. That's what you want to prioritize. So pediatric case, so 16 and less, an older adult, 65 and more, mental health concern, an established long-term condition, an acute case requiring urgent investigation and referral, maternal and reproductive health, which can't include breast lumps unless the breast lump specifically is in the postnatal context. So when you have a look at the RCGP website, and it's really important that you do reference your reading around this, because the guidance is often updated. It's not necessarily put out there to everybody on time. So make sure you always have a look at the RCGP guidance, but specifically low challenge cases to avoid, as mentioned, follow-ups, medication requests, pill checks, recurrences going through results, sick note requests, and then you can see a number of curriculum areas that you don't really want to be using. So dermatology doesn't sit particularly well with the RCA. In addition, simple infections or ERTs, simple eye and ear problems. So these are cases that you don't want to be submitting. When my registrars come to see me and ask, is this a good case? I always ask firstly, what's the clinical challenge of the case and what are the complicating factors to the case? So for example, if we look at a 2-week wait, if a 2-week wait is obvious from the outset, then actually that's quite low clinical challenge. So for example, if you saw a patient who had a cough, weight loss, they're a smoker, they're worried about cancer, then we already know what we're going to do. There's very low clinical challenge to that as a case. So you must think, in addition to the clinical challenge, what are the complicating factors to the case? And these are going to be housed within the patient's ICE, as you can see, or specifically if there is a deeper psychosocial narrative, which makes the case that you're going to be submitting something that's a bit more interesting, something which has a bit more complexity and depth to it. So the way to really sort of case select is to have a look at the e-consults that are coming in, to kind of see what the presenting complaint is, having a look into the patient's notes. Sometimes in the e-consult, you can see what the patient wants from you. So if we work through an example, a patient who is perhaps going through the menopause and quite adamant in the e-consult that wants to go on to HRT, but actually when you have a look in the notes, there might, for example, be risk factors which might somewhat compromise the safe use of HRT, then actually that's going to be potentially a good case, because there's going to be negotiation about informed risk, there's going to be shared decision-making, and inevitably an outcome and a decision can be made within those 12 minutes. So hopefully that's giving you a bit more insight as to what to look for when you look at your cases. Do feel free to have a look at my resources on mentalmededucation.com. Thank you very much to Patrice for inviting me. I'm very happy to do some more resources and look forward to seeing you guys soon. Many thanks.
Stay tuned because Dr. Nigel Giam will be providing us with more tips in a second video. As always, if you enjoyed the video, be sure to give it a thumbs up and hit the subscribe button. I'll be seeing you in the next video.